Hello everybody, thank you for taking the time to watch this video today. My name is Nick Goldup, I'm the Director of Care Improvement at the M&D Association. As you may have seen through our previous videos, we at the M&D Association decided to engage with our wonderful healthcare professionals supporting people living with M&D across the country to understand the issues and changes faced during these uncertain times by services. So for this, which is our fourth video in our suite of videos, we're lucky to have three terrific guests from the world of speech and language therapy, and who many of you I'm sure will already know. Firstly, Zoe Clark. Zoe is a clinical scientist with the Barnsley Assistive Technology team and lead for NHS England for specialised environmental control services. Secondly, we've got Julie Atkinson, a speech and language therapist from the Access to Communication and Technology Centre at the West Midlands Specialised Service for AAC and EC. And she's also the NHS England lead for AAC services. And thirdly, we've got Richard Cave, speech and language therapist from the Royal Hospital for Neurodisability in Putney, which is also a specialised service for AAC. And he also works with the M&D Association on a number of technology projects. So welcome to you all.
Thank you.
Thank you for joining us. So straight into the questions, I think. There's the first question I'm going to ask Richard, which is for those that are watching today that aren't familiar with the roles of speech and language therapists, or the structure of services and the meaning of all of these acronyms I've just bombarded you with, such as EC and AAC. Richard, could you give us a quick summary of what services entail?
Yeah, sure. I just thought, first of all, I'd say I think these M&D Association video interview panels have been incredibly useful. I watch the others and I've referred clients to them, and I think it's, in these difficult times, having this as a accessible, useful source of information to kind of provide clarity and direction is actually very useful. So first question is kind of, what's a speech language therapist? Well, speech language therapy, we help with many things and we work with many people. And one important area is to help people to communicate what they say and their everyday needs. And another is to provide help and advice if it gets difficult to eat and drink, or there's a worry about it. And it's a sad fact that many people living with MND can progressively lose the power of speech as well as movement, and we work with them as we will work with their significant others, friends, colleagues, to help maximize their communication as these things change. The priority is for people living with MND to still be able to communicate what they want to say and share the important things and keep in touch with everybody and maintain their friends and their social networks. And so in the early stages of MND, voice quality or strength may change, and it could be just the simple things like a quieter environment with the radio off, for example, was enough to help people with weaker voice to be understood, or perhaps using kind of additional tools such as a voice amplifier or pen and paper or a tablet to help speak a message, to type and speak a message that could explain what's being said. And anything that supports communication in this way is sometimes called AAC, and people call these devices AAC, and the term stands for augmentative and alternative communication. Augmentative is to supplement, alternative is to replace, and really it's just a fancy term for something, for a device or a method that can help with communication, be it pen and paper, an alphabet chart, all the way out to the high technology stuff like an eye gaze system that allows somebody to type messages using their eye movement alone. I think the important thing to remember here is that, MND is a journey, and as speech changes and as eating and drinking, if there's a worry about eating and drinking changes, it's important to work with speech and language therapists as early as possible, even at the position where actually there's nothing that's changed, but just to plan for the future, to build some certainty, to build some plans into how things may or may not go, and to understand what AAC is, what options there are, and how they may help. So your local speech and language therapist will work with you initially, and if things progress or if things get significantly more difficult, with complex with voice loss and difficulty with movement, your local speech therapist has the benefit of being able to refer to a specialist AAC service that can help you and help them to provide equipment that could support you with complex difficulty. And just another term is EC, or environmental controls. And these are systems that help people with physical difficulty maintain their independence as far as possible. For example, something that would help you switch the lights off and on, or change the channels on a TV, just switch off and on a fan, which is really important on a day like this, very hot day, and or make themselves more comfortable in a bed or chair. And these environmental control services are sometimes part of specialist ASC services, and they're sometimes separate depending on where you live. And the best thing, if you want to find out more about environmental control or AAC, or you have a worry about your eating and drinking, is to talk to your local speech and language therapist, or in the terms for EC, your occupational therapist, or indeed any professional that's working with you, so that they can either help themselves or they can refer onwards to another team.
Thank you, Richard. That's a fantastic summary, and the role of the speech and language therapist is such a big one as part of the multidisciplinary team for people. So, Julie and Zoe, would you add anything to that?
Yeah, just I guess in terms of, as well as from the environmental control side, also the role of occupational therapists in that. So it would be a local occupational therapist identifying or speaking to people about if things have changed with their physical access to things, so how they're able to control, say, their television remote, or perhaps touch on the screen of their tablet. And then the occupational therapist may have some suggestions for that, or might get in touch with the specialised service around that. So, as you say, a big part of the multidisciplinary team there, building that together to come up with those solutions.
Thank you.
I'd just like to bring in as well the Motor Neurone Disease Association advisors, that certainly they make quite a lot of referrals to our services as well. They're very aware of where we are and how to get in touch with us as well. So
thank you all. So hopefully that helps to start with, because we all know what the abbreviations mean now, so that's brilliant news. So Zoe, can I come back to you with the second question, which is, we're still going through this coronavirus crisis, and hopefully coming towards the back end of it, let's hope. So what's changed most for you and your team during this period and this crisis that we've been through?
Yeah, I think for my team and for teams nationally, both in terms of kind of specialised environmental controls and AAC, the biggest change has been being unable to see clients face to face. And generally this would be done in their own homes or in their own environment, and that's quite a big change for us. When assessing for environmental controls in people's homes, it's really beneficial to be able to see where people are, what they're wanting to be able to do, what equipment they've got already. And so not being in that environment to do the assessment has been a little bit more challenging. My team's been able to support our hospital trust in the response to COVID pandemic, which means some of our staff have been redeployed, but we have been able to continue our services. And in most cases, we've been doing that remotely. So we've been taking new referrals, and we've had a kind of remote first procedure where we've used telephone and video calling to undertake assessment. And then we've been couriering equipment out and doing further video assessment to support the use of that technology. There has been success with this, so it has worked, but there also are challenges because the process isn't ideal for everyone. Sometimes people set up in terms of being able to have a video call, people's ability to kind of, suddenly this new piece of technology comes into the house, and trying to set that up, even with quite a lot of instruction, we're just not there to press on the buttons ourselves. But we have been able to meet some of people's goals, and where we haven't met all of them, we've got a system of kind of putting them on hold and kind of regularly reviewing as the situation evolves, which it is doing all the time. And in addition to our new referrals, both EC and AAC services follow a kind of maintenance process for people who've got our equipment. And again, this is just as important as those new assessments, because people are using their equipment all the time. And so we provide a fault response and preventative maintenance. And for all the teams, as much as possible, again, faults have been supported with a remote first approach. And recently we've been looking at, as a team, and also I've been in some national discussions around remote maintenance, so that we can make sure we avoid people having faults before they come up. And that's quite an interesting way to work. It's definitely kind of testing some new ways of working. When we do when we are looking at it, if we get to a point where we do need to visit, we're following NHS community guidance. So we evaluate quite carefully whether a visit can take place, whether we've done everything possible remotely, and whether people are happy for us to visit, because I think obviously it's a two-way thing, and it's an extra person coming into the environment. And what we've been doing for that is then taking all mitigations to kind of minimise contact once we're on site, if we do decide to do a visit. So we've been doing things on the drive, doing things, swapping a remote control across the doorway, cleaning it down and putting it back through the house. And so I think that's worked quite well, and it's definitely made us be a bit more creative in that. And where we do need to go into a home, again, taking precautions to be a good distance away, and obviously using appropriate PPE. So yeah, there has been some variation around the country. So our team's been able to support a lot of remote support, but in some cases there's been a bit more redeployment. But the majority of services have been able to evaluate high priority referrals and have been responding to all their fault calls. So I think that's what's been going on. But it is a big change, that difference from face to face to over a video, which I think we're all finding with all things like this and calling. But it introduces some challenges, but has given a lot of learning as well.
Yeah, definitely. Anybody, Julie, would you like to add anything to that?
Our experience is pretty similar. We had more, certainly my team had more redeployment, I think, than Zoe's team. We're starting to get people back now, but so we've been a little bit slower maybe to start doing the remote work, but we're definitely we're up and running. I did one yesterday, I've got one tomorrow. Yeah, so we're really moving forward with that. And when we're talking about remote, we're not just talking about this kind of technology. Certainly we're doing lots of phone calls, the good old-fashioned technology.
Yeah, definitely.
Thank you. Okay, so I mean, we talked about referrals there, and Julie, perhaps I can ask you about that. So how have referrals to AAC and EC services been affected during the current period? And excuse me, and how do you see this impacting services going forward?
Well, certainly the referrals to our specialised AAC and EC services for people with MND, as Zoe's already said, they usually come from speech therapists, OTs, or the MNDA advisors. Certainly at the beginning of this pandemic, our referral rates were significantly reduced. And actually we could hypothesise that might be for a variety of reasons. It might be, as we know, staff from the NHS have been redeployed to those critical hospital areas to treat the very poorly coronavirus patients, and also to ensure that people that are there for rehab go home to free up the beds. So perhaps staff who would normally make the referrals to us have been redeployed as well. The referrers might be thinking that our services were closed, or we weren't accepting referrals because we couldn't see people face to face. And importantly, there might be some people with MND that now just doesn't feel like the right time to be referred. It's one more thing to have to think about. Or they might be really worried about somebody coming into their home and needing to see them in person. Whereas actually, as Zoe's emphasised, we're doing very much remote first appointments. So to reassure people about that. The last couple of weeks, certainly we're having a steady stream of people with MND and certainly with other conditions being referred to us. And we've been working really hard to try to let referrers know that we are open for business, we are taking referrals and we are seeing people. I think moving forward in terms of service provision, each NHS trust has been developing its own recovery plan to get services going again. A lot of services have not been able to see them anywhere near the number of patients that we would normally see. So it's balancing that recovery plan whilst we're also heeding the government's advice, who we're able to see using the community guidance that Zoe's just mentioned. I think we're anticipating a gradual return to business as usual, although usual may look slightly different, and there might be more technology and remote appointments within that. So as staff return to their permanent roles, as lockdown eases, and hopefully people are feeling a bit more comfortable around other people, we might get more referrals in. I think we've always been in regular contact, the AAC services and the EC services. We meet regularly anyway, and Zoe and I have good links together. So we're definitely learning what works best from each other. We're trying to avoid reinventing the wheel and duplicating things that might have been challenging for other services that maybe have done things earlier in the process. As Zoe says, we're using remote first, really importantly, ringing people up, talking through maybe what's becoming difficult to identify, see what we can help with over the phone, then using video conferencing. There's lots of different things. FaceTime, WhatsApp, if people have those, as well as more formal sort of Microsoft Teams or WebEx or whatever. And she's already said that using this technology is so important to see people's environments, see what computers they've got, to know how to access them, what equipment, TVs, lamps, those kind of things are in the home. So I think the really important message for patients is that we are still assessing people, we are getting equipment out to them, we are carrying out progress reviews, and certainly we're repairing faulty equipment, but albeit perhaps not in our usual ways, and thinking about maybe some changes to practice that we will keep moving forward because they've been really positive, as well as identifying those aspects of service delivery that perhaps we haven't actually missed and we might not reinstate in the future.
Thank you, Julie. That's a really important message, isn't it, for the audience? So thank you for that. That's excellent. So Richard, can I come to you, just sort of following on from access to service? I'm thinking about can people still access things like voice banking, which, as we all know, is very important that people can access that as quickly as possible, but also other communication aids and environmental controls during this lockdown period?
Yeah, I mean, I'm just kind of really want to emphasize what Julie and Zoe said as well, that actually, you know, everything's open. We're still open. We are still open. And actually, if there's anybody listening to this, you know, a person living with MND or significant other, family, friend, if they have got a question, if they want to find out more, we are still open. And if the local speech language therapists, we are still open for those referrals. So, you know, we don't want COVID to cost any more than it's costing right now. We cannot afford that. So, and the one thing we're all aware of is, you know, regardless of COVID, MND is still progressing. MND is still out there. So those problems have not changed. So of course it's, you know, it'd be interesting to understand why there was a drop off in referrals, and you can see why there are multiple reasons for that, but we're all open. So the answer to your question is yes, of course, but you know, just to say that we are changing our practice very much so. So you mentioned about voice banking and doing lots and lots of voice banking support, and all of that is online now. So you know, we don't visit people. We give them video support. So we train speech language therapists and other professionals, whoever works with MND and would like to understand about voice banking and to get their own voice bank and demo it to their patients. We do that. And, you know, just in July, training about 40 professionals online. to create their own voice bank, and in August I'm hoping it'll be a similar thing. So we're definitely open and just kind of get in touch, and talk about changing practices. Perhaps if there's one kind of light at the end of this awful COVID tunnel, is that I've been forced into different practice, but relying on remote video support and all the rest of it, and actually some of it's worked out really well. Others is more of a challenge, a lot more of a challenge. But in terms of the video support, I'm doing that every day, as I'm sure all of us are. So, and the MND Association, we're still loaning stuff, iPads and light writers and headsets and remote loan of apps and all sorts of things. The only downside to say with the MND Association loan service is that, conversely, we've been inundated with demand. We've got a lot of demand, and actually we've had to kind of push out our response, response from 10 working days to nearer 20, and it's just, there's just a lot of demand out there, and it could be that because some of our stuff we can install remotely and everything can be done remotely, and I'm not sure, but of course loaning of equipment from the MND Association has its own issues, because actually some of this equipment should be provided by local services, and that's an ongoing issue that I know we're all working on, that that local services should be funding that equipment, but given where we are now, given the urgency that is usually surrounding MND plus COVID, it's like, okay, well, let's help people right now. So that's pretty much where we are.
Thank you. That's a pretty clear message. We're still open for businesses and always have been. Zoe, can I ask you a question about staff? And so when I've had some of these calls, videos before, I've talked to services about redeployment of staff and the impact of that. I just wondered whether any of your staff have been redeployed.
Yeah, I mean, I think kind of looking nationally, there's been kind of considerable variation within the specialised teams in terms of redeployment and how people have been supporting their trusts. And I think a lot of that has stemmed from kind of localised trusts and how they've needed to respond to COVID in that locality, where there's been different demands on services. Within our team, we've been able to support our local speech and language therapy team with a couple of members of our staff doing some days for them each week. And then also within the hospital, we've got an in-house tech team within our specialised service, and they've supported the estates team within the trust and clinical engineering in terms of undertaking some of the work on when new equipment's come in, like when there was a large influx of kind of ventilators and things like that, enabling those to be tested and getting into place quickly, enabling just general support for PAT testing and things, so electrical testing of things to enable things to be as efficient as possible just for the general running of the trust. But I think the other key thing from a specialised service point of view in terms of that redeployment is a lot of local services have also been affected and have kind of moved their priorities in terms of what work they've been doing and how their staff have been redeployed, or if not necessarily redeployed, the focus of what their work is at the moment in terms of that priority. So again, in terms of referrals coming into us, it may be that although we haven't had large scale redeployment in our team, some of the local services that feed into us have had much more significant redeployment in terms of the COVID response. Again, around the country, there's been more or less redeployment in terms of the specialised services. But I think what people have tried to do, even when they've been left with quite a skeleton service, is ensure that referrals are being kind of looked at and appropriately prioritised, and where possible, in some cases it's been possible for people to have kind of a temporary system to tackle some of the immediate problems, like maybe calling for attention. It might be possible for someone to have a pager with a switch that is not the long-term solution, but does help in the short term. And also in terms of, like I mentioned earlier and others have mentioned, the kind of fault response, so ensuring that people who have got equipment are keeping things going. We do recognise that potentially there has been a little bit less fault calls, and the contractors we work with too. So we've been very much kind of planning as well for kind of being conscious that at some point we might get a sudden influx of work. So we've been trying to really stay on top of what can we do now to kind of stem that flow if we do get a sudden influx when things are a little bit more relaxed, or when people are a bit more comfortable with seeing people and perhaps think, oh, that fault, I've been managing with it, but now I want to report it and get it sorted out, and getting that in place. So I think there's been quite a lot of variation, and obviously people have been keen to support the COVID response. And again, there's a bit of variation in how that's in how people are coming back to services, if that makes sense. Some people that was quite short term, and for other people that's been a bit of an extended period. But I would just echo Richard and Julie in terms that we have been open for business, and I think it has been reassuring that although the numbers of referrals have dropped a little, that we have had a steady stream. I think right at the beginning, particularly our team, we just wondered if we'd just get a complete kind of stop on referrals due to the situation, but it's been reassuring that we have kept that going, and I think that the word has been out that we are open for business.
Yeah, thank you. And I suppose following on from that, my next question, perhaps Julie, I'll put towards you, which was, if there has been some redeployment of staff, how do people with MND get that support?
Yeah, well, certainly I think it would be very unusual for an entire team to be redeployed. So although some teams are left with fewer staff, there's always going to be somebody that will be there, both in a local speech therapy team as well as the specialised services that you can seek support from. Also, that many staff are actually working from home at the moment. One of the issues that we've got is that due to social distancing, actually we're not allowed the same number of people in the building or the office. So it may be that if you're ringing an office to ask for some help or support, that they have to take a message and get somebody to get back to you because there aren't the physical people there in the office that people are at home. I think if you need support with regard to equipment that you've been given, do contact the service who provided that, whether it's local speech and language therapy, the Motor Neurone Disease Association, or one of the specialised AAC or EC services. There's always going to be somebody there to help or advise you what to do next, or in some cases for environmental control or AAC even, it may mean contacting the equipment manufacturer as well, and certainly they're all still working. I say EC systems particularly because some of these are maintained by contractors on the NHS's behalf, and again they're doing what we're doing, remote first and visits only when essential after careful consultation with us and with the patients and after risk evaluation. And we would hope that people at home, that you've got the numbers for whoever maintains your equipment, or if not, then as I say, contact the services. I think it's as well to think about, we're not just talking about equipment faults here. People with MND, unfortunately, your condition does change. Speech changes, movement changes. So if you feel that something has changed that's stopping you from using equipment that's been provided or making it more difficult for you to use, do contact us, because there's likely to be some adjustment that can be made to allow you to keep on using it. That's really important to know. In terms of the communication aids, a lot of the companies are putting lots of resource materials on their websites. They're offering lots of webinars, as indeed are the MND Association, and companies, the AAC companies, have always offered remote support, so they've always had a real strength with that anyway, dialing into people's communication aids and accessing them remotely. So nothing has changed there, other than there's a few more of them working at home perhaps, or furloughed, but they are still able to support. The other thing that I did want to mention is that prior to COVID, the specialised AAC and EC services were beginning to develop a website with lots of resources on for patients, families and professionals around AAC and EC. We're really pleased to have got a version of this online in these challenging times. It's perhaps not quite as we would have wanted it, but we've got a version of it up with lots of low-tech paper-based resources for people to try, also lots of coronavirus resources as well. So there's that support online, and I'm hoping, Nick, that you'll make that website available afterwards. But if I just say, it's www.assistive-technology.org.uk. We're hoping to get an NHS domain name for it, but in the scheme of things, just getting information out there was prioritised rather than getting .nhs and going through those pathways. So, as we keep saying, staff may have been redeployed. For some of the companies, staff may have been furloughed, but we are still very much open for business and moving forward, seeing people making things happen with their equipment.
Thank you, Julie. That's brilliant. That's brilliant, and a great plug for the website as well. So we'll make sure that that's communicated through the channels we've got as well. Just thinking, Richard, perhaps talking about technology, really, with your technology hat on, and technology is so vast and it's so broad, and there's lots of opportunity there. But in a summary, have you been embracing new technology to support people living with MND during this period?
Yeah, we've been looking at this in two ways. The first is kind of the actual experience of people living with MND through COVID, and actually what technology they've been using and how easy and difficult that has been. You know, because we're talking about a vulnerable group here who are normally unable to leave their homes, or haven't been so far, and actually be able to only keep in touch via technology, be it the phone, by video call, that kind of thing. And actually what we found is, you know, this age group is often between 55 and 75, and there are many people with MND who are really good with technology, and others find it a bit more challenging. And this really matters. This really matters because to keep in touch with loved ones, family, friends, even to be able to go online and order food and all that other stuff is through technology. And we found many people who have been kind of, not through no fault of their own, have been left behind with this technology because it's just complex and they're just not used to it. So from MND Association perspective, we have been talking with Microsoft and Google about this, and actually offered our feedback on actually how this has happened, and actually how we can keep people from being left behind, because the future is clearly going to be a lot more of this stuff, a lot more of using technology for communication. So the question is, how can we include everybody in technology for important stuff like keeping in touch with their loved ones? So those are the questions that we're having ongoing with Microsoft and Google. And in a separate project, which is related, we are supporting the Euphonia project with Google. And the aim of that project is for people with changed speech, with dysarthria, as it's called, or slurred speech that has changed, to still be able to use voice assistants, stuff like Alexa, Google Assistant. And if Google Assistant can understand speech that is changed, which it can't now, but if it could, then it kind of unlocks everything that voice assistants can do for all the rest of us. And that means, you know, access to switching lights off and on, changing TV channels, getting directions, listening to music, all the stuff that voice activation can do right now for the rest of us. And the big problem is that for the very people who would benefit from that most, they are blocked from using Google Assistant because Google Assistant doesn't understand them. So what we're doing is we are helping Google to train Google Assistant to understand what slurred speech actually sounds like. So we have a project where we are inviting anybody, regardless of diagnosis, MND or any other, just as long as they're adult and they can consent, and to help us read some phrases, to help us train Google Assistant and eventually all the others to understand what slurred speech actually sounds like. And I think that's a very important project. It's still research. We haven't got any results yet, but yeah, I think it's worth doing. And yeah,
I think that's very exciting, and I totally agree with you. You know, technology and the way it can support people with MND is something that we're fully behind and need to support. So thank you for that summary, Richard.
I think that's in terms of environmental controls, that's always something like it's very easy to underestimate how important being able to kind of change your television controls independently or turn on and off your lights, you know, in the winter when it gets dark at 4 o'clock and perhaps you don't have a care call until 5 and you're sat in the dark. It's a massive kind of impact on your quality of life and independence if you are able to do those things yourself, and voice and a big range of other access methods do you know offer the key to that. And the advance in technology and kind of research like Richard has just alluded to, it just, you know, is quite exciting for how the world of environmental controls and AAC kind of all evolve.
Yeah, I totally agree. Yeah, so I'm just short on time a little bit now, but there's one last question that I'm going to put to you, Zoe, if that's all right. Because we've talked a lot about changes to the services and during this lockdown period, and I just wondered, do you think we'll carry on with it, with the, you know, implementing the changes or embracing them that we've seen over this lockdown period?
Yeah, I think as a team and in our national discussions, we've definitely identified some benefits of, particularly around the remote assessment. But I think what it's given us is an opportunity to test something in a way that we wouldn't have been able to test it had we been in normal operation, because we've really had to kind of use it and kind of push the remote as much as we can, which what I think this has offered the potential for is really evaluating when it's good, what it's good for and what it's perhaps not so good for. You know, in a kind of real life test, we wouldn't have done it quite like this in kind of normal service. And so I think what we're looking at is how we kind of integrate that remote support, you know, not just video, but telephone, how we kind of keep distance, how we make visits as short and efficient as possible, which I think is something that's beneficial anyway, because people with a variety of conditions can find a long visit quite tiring. So, you know, putting into practice using our abilities from the remote assessment and remote support to make any visit we do need as efficient as possible will help improve kind of efficiency and flexibility for clients. And we've also seen some really kind of good benefits from and feedback from clients and carers and family around how they felt quite empowered. I think sometimes kind of not intentionally, but perhaps when we go out to someone's house and demonstrate some equipment, it's easy because we know what we're doing to kind of, you know, we do some training on it, but we might tap on the screen or do a bit of the control or do quite a lot of the setup because we're there and because we know it's human nature, isn't it? We will do it a bit when we're showing someone how to do something. But I think what we've had some feedback about is how, because we've been explaining it remotely and sending instructions and sending videos, people have had to do a bit more of that themselves whilst feeling well supported with that. But they found that quite empowering and felt that they've perhaps understood a little bit more about how things work, or perhaps it sparked a bit more curiosity just to kind of think, oh, actually, now I've seen that it can do that, what else can it do? And we find that a really, really important to kind of feed into our overall feedback. As I say, we do, you know, we have also identified situations where some of these changes haven't worked quite as well, but we're putting that into the big kind of amount of information we've got to kind of inform our future best practice.
Thank you, Zoe, and thank you, everyone. I've really enjoyed the discussion today. We've been very lucky to have your time, so thank you so much for answering my questions.
Oh, thank you for asking us.
You're welcome.
No problem. So thank you. And my colleagues within the care team will bring together all the key points from today's session and communicate them through the MND Association website. So please do take a look at that over the coming days, and I'm sure we'll be able to cascade this out through social media as well. We've got a specific coronavirus hub on our M&D Association website, so do have a look there, which you can access through the homepage. And plus also take the time to speak to some of our staff through our M&D Connect helpline, which is 0808 802 6262, for any questions that you may have on anything that we've talked about today, or anything else for that matter. So thank you again, everyone, and please do take care. Thank you.
Thank you.
Thank you.
Thank you.